Unexplained infertility is perhaps the most frustrating diagnosis to have. You've been trying to get pregnant, have done a whole bunch of tests, and everything comes back normal. So what do you do? Find out on today's episode of Infertility TV. First, make sure you have completed all of the standard infertility tests. You should have checked to make sure that you ovulate, that your uterus is normal and fallopian tubes are open, that your ovarian reserve is normal, an ultrasound of your pelvis is normal, your thyroid is functioning as it should, and your husband has a normal semen analysis and CapScore. If all of those tests are normal, then you can consider a few different treatments to speed up the time it takes for you to get pregnant. All of these treatments have two things in common. They use some kind of fertility medication and some method to increase the chance of getting his sperm to meet your egg. Let's start with the easiest treatment. This uses the fertility medication called Clomid or clomiphene citrate. The idea here is that normally you release only one egg each month. Using Clomid, you can increase the number of eggs released and have a better chance that one of those eggs will get fertilized and implant in your uterus. It's very important that your doctor monitors you to determine when you ovulate. At the time of ovulation, instead of just having intercourse alone, consider having an IUI or intrauterine insemination. This will increase the number of sperm that gets into your fallopian tubes and increase the chance for pregnancy. This is true even if your partner has normal sperm testing. You can try Clomid with IUI up to 4 times. If you are still not pregnant, consider moving to a different treatment. Another option is to use injections of fertility medication instead of Clomid. Injections like Follistim or Gonal-F are more potent than Clomid. It is more common to get more eggs to develop. As a result, the pregnancy rates with injections are higher than for Clomid. You should also do IUI with injections. Now, a word of caution here. The pregnancy rates are better, which is great, but there is a higher risk for having a multiple pregnancy compared to Clomid. And we are not just talking about twins. There is a higher chance for having triplets, quadruplets, or even more. One of the best treatments for unexplained infertility is IVF. The pregnancy rates are higher than they are for any other treatment. An added advantage is you get more control over your risk for multiple pregnancy. The best IVF programs in the world in 2019 put back one embryo at a time into the uterus, and so the risk for a multiple pregnancy is only a few percentage points. Hey, if you like this video, remember to please like this video, and if you have a question, leave it in the comments. We'll answer. Just click the link in the description below if you want to become a patient and become a subscriber. You get new episodes weekly. It's like having your own fertility specialist in your phone.